afternoon. I am Maricel Santos and this is the tracheostomy care procedure. So here, I have here an improvised tracheostomy. This one, flange, then the whole thing, the inner cannula, and the thigh. Okay, and the face mask will act as oxygen. I have here all my equipments gathered, which are sterile gloves, extra 4x4, 10cc, stethoscope, clean gloves, pulse oximeter as well, and I have a sterile equipment there. This sterile equipment consists of cotton applicator, tracheostomy tie, what else? The brush, and then assuming that this is the plain NSS, and then this is the hydrogen peroxide. And I have 3 trays, 3 trays, which I'm gonna put which for cleaning, rinsing, and then soaking, cleaning, rinsing. That's the 3. And this is where I'm gonna put the Kelly forceps. Okay, so hello po, I am Marisol po. May I know your name?
Yes.
What's your name?
I'm sure.
Okay. Clean ko lang yung stoma ha. Clean lang ni ate to ha. Para hindi ka magkaroon ng ng bubu, ng dumi pa, okay?
Okay. Alam ko yun.
Alam mo yan. So, inform natin yung patient, since this is a kid, as the parents, that inform them that you will remove the oxygen for a while. I will just remove this, okay?
Okay.
Provide for client's privacy, of course, and then position the client. Sa bedside lang itong oxygen. The position of this is the semi-fowler or 45 degrees angle. To assess the patient. So, in assessing the patient, we will auscultate it. Auscultate the lung sound. Hello. Wait lang. Check lang niya yung ate. Okay. Auscultate. Check if there's a bronchi, friction rub, wheezing, any obstruction na didinig mo sa patient. Okay. So, if there is, you will suction the patient. So, let's assume that merong bronchi. So, sinuction natin yung patient. After suctioning the patient, what you're gonna do is to check the oxygen of the patient and then capillary refill. Okay. So, I'm gonna put the NSS first. I will pour the NSS. Then, I will get the inner cannula. Okay, so in removing this, counterclockwise. So, sa real scenario, there's 2 blue point here. Para pagka binalik mo, malalaman mo if matiklik siya. So, yan. Remove it first. And then, drop it. Ayan. Soaking. Okay, then, remove the gloves. Put it to yellow. Okay. Now, we will set up the sterile fields. In doing that, of course, you have to use the sterile gloves. Dominant hand first. Oops, the flaps. Okay. I will cut this. So here. Dominant. Leave it. Sterile to sterile. crap. It's okay, it's okay. Then, steril na to. Down. Drape the patient. It's a real life. Meron pang another what you call that? A cloth to open it, and then you just have to open it. Inside the sterile kit, there's a cotton applicator. There's also a 10cc syringe, straight tie, and I have here the pre-cut dressing, and I have also, of course, the extra 4x4. I'm gonna clean the inner cannula. So in cleaning this, you get this, clean it. Sometimes they're using pipe cleanser, but since we don't have that, I don't even have a brush. I'm just assuming that this cotton applicator is gonna be the brush. So yeah, clean the insides as well, and then dry it. So in drying it, just air dry. Tap, tap, tap. So sometimes they're using pipe cleanser, but here we just have to avoid using gauze, because the fibers there might leave marks, and then we're gonna put it back to the patient's trachea, so it's not gonna be good. After air drying it, using my one hand, which is this is sterile, I'm gonna remove the pre-cut dressing here. I'm gonna remove this. Okay, and then put it to trash, of course. Then we're gonna change our gloves. Okay. After that, we will clean the stoma using the cotton applicator. So in cleaning the stoma, you're gonna do it 45 degrees, okay? You're gonna do it from inner to outer. It's okay. Inner to outer. Inner to outer, inner to outer, inner to outer, inner to outer. Okay, let's have it like this. Just cotton applicator. Can I clean this from inner to outer? Inner to outer, inner to outer. Excuse me, baby. Inner to outer, inner to outer. Okay. And if the phalanges are dirty, of course you just have to clean this. In the real scenario, you just clean it, okay? And then, of course, throw it to trash. Then, after that, you have to wipe it. So, in wiping it, we will use, of course, the extra gauze that I have. Okay, pat dry only. Pat dry, pat dry, pat dry. Okay, so after that, we will put back the inner cannula. This is air dry na. Just tap here again. Just make sure. And in putting it back, of course, kanina, we removed it counterclockwise, and now, we'll put it back sa inner clockwise. Now, it's clockwise. Then, we will hear the click. So, sometimes nga, they're putting, they have markers, like 2 markers here, para pag nakita mong pantay na, that means, yeah, closed well, and that's correct. After that, the pre-cut gauze, we will put it back. No, put it back. We will put it. Okay. Okay. So now, okay na yan lahat. Ang natitira na lang yung tie. So, in tying this, tie knot, of course. Ganyan. The first thing that we have to do is to put it first away from you. natin nilalagay siya ng una para maiwasan yung matanggal. At least, bago natin tanggalin, may nakasupport na. Okay. Angat natin si patient. Okay, sa tatali. Lagay lang natin. Bago natin tanggalin yung old tie. Okay. So, tatanggalin na natin yung old tie. So, since tie na naman siya, remove the old tie. So, you can see, still intact pa din. Okay, I threw it sa trash. Still intact pa din yung kasi inuna muna natin ikabit bago tanggalin. So, now we will tie knot. Kung sino yung pumasok, yan. Tie knot. Well, that's it. That's it. That's the tracheostomy care. This.